Hello everyone, we are the international students from the University of Tokyo. Today we would like to present about Japan's public health response, cross-cultural completed lessons from COVID-19. Our group consists of Eden, Ganen, Yanjir, Faber, and me, Choosing. This is an outline of our presentation. Firstly, we will talk about history of infectious disease control in Japan. Secondly, government intervention during COVID-19. Thirdly, we will give relevance and current examples. And lastly, we will talk about cultural and etiquette considerations. This is a background country profile of Japan. Currently, 125 million people are residing in Japan, and 27.7% of the overall population are adults between the ages of 16 and 79. 8.5% are 18 years and above. So Japan is the senior aging country, and older adults are highest risks of getting very sick from COVID-19. More than 81% of COVID-19 deaths occur in people over age 65. History of infectious disease control in Japan. From the pre-COVID era, elimination of global infectious disease had been one of the key targets in public health policy for the government of Japan. The Ministry of Health, Labor and Welfare established Global Infectious Disease Control Office on October 1st, 2017. In a historical perspective, the burden of indigenous infectious disease has dramatically decreased in Japan over the past century. For example, reduction in number of deaths due to tuberculosis, eradication of indigenous malaria, diphtheria, and measles. Incidents of new disease outbreak raise great attention toward infectious disease control. For example, dengue outbreak in Tokyo in 2014. There are excessive measures against previous infectious disease outbreaks. For instance, measures against leprosy patients based on eugenic protection ideology. These include sterilization correction and forced isolation. These promote prejudice, discrimination, and persecution due to the above. The infectious disease control law specify reflection on past administration regarding leprosy control. In Japan, it is necessary to take seriously the fact that in the past, there were unjust discrimination and prejudice against patients with infectious diseases such as leprosy and acquired immunodeficiency syndrome. And to apply the lesson learned in the past to the future, respecting the human rights of patients with infectious disease. Deep reflection focused on respect for human rights and prudence in limiting private rights. High levels of normative awareness became the main focus of infectious disease control in Japan. Japanese people, they have good cultural habits of hygiene. For instance, bathing, hand hygiene, and using oshibori, gargling, and mask wearing. These may play important roles when battling against infectious diseases.
So during the COVID-19, Japanese government has never declared the lockdown, but instead of that, they have implemented the basic policies against the COVID-19. So the important point of this policy was to early detection of and also early response to the clusters, and they used the retrospective method. And also another point is that they try to minimize the impact on society and also economy through behavioral modification of the citizens. So based on these objectives, the government tried to control the disease. For example, in April 2020, a state of emergency was declared by the government, but it lasted only for about a month. So, at the end of the May, a state of emergency was lifted by the government. So during the state of emergency, the preventive measures were taken, and the important point of this policy was to minimize the restrictions on people's freedom and rights. So considering the human rights, government never made staying home compulsory, but rather encouraged it. The government requested behavioral modification from the public, including the new lifestyle and also avoiding the trees. So the important point is that the government has never enforced the penalties on non-compliance. And another thing is that the government never requested the restrictions for activities that are necessary for maintaining daily lives, such as like visiting hospitals, purchasing foods and medicines, and going to work as necessary, and exercising outdoor. Next slide, please. And this figure shows that how the rate of new infections decreased by each degree of the government intervention. And the government intervention here is such as the degree of enforcement of the curfew restrictions and the amount of personal information which the government can access. This result indicates that in Japan, the number of new cases is easily decreased with the mild government intervention. While the other countries, such as Korea, needs relatively strong intervention to get the similar outcome as Japan. And this may be explained by the public's normative consciousness. So during the COVID-19, basically Japan's government asked good and people just listened to that. Next slide, please.
So although the interventions implemented by the Japanese government were somewhat effective, these interventions are not without fault. So to begin with, the Japanese governmental system is a federal system, meaning that it's limited and it has a limited national level impact, and there is also no legal binding force. As well as that, the public health system lacked clear indications and guidelines on what to do and how to do it during the COVID pandemic. As well as that, the medical care provision was insufficient, as there were an insufficient number of medical staff per bed and an inappropriate allocation of medical staff as well. And publicizing information was also lacking, as there was a lack of correct epidemiological information and no standardized method for how the information was publicized as well. And to continue, there was a lack of ideal expert advisory board, and which meant that there was no expert model to implement during the COVID pandemic. And regarding the infectious disease research system, there was also no centralized system for epidemiological and clinical research during the pandemic. And the testing system in Japan was quite late in establishing an adequate testing system because, again, COVID was one of the first major pandemics that the country had been through. And finally, there was no ideal state of a command center, which made it quite difficult to curb the rise of infection at the peak point of the COVID pandemic. So for future pandemics, it will be important for the Japanese government to work on unifying itself and its institution, and also to develop a solid base for epidemiological and clinical research.
So I'll be going over the relevance and current examples. So both of these pictures were taken in summer 2022 in or near train stations in both London and Tokyo. And as you can see, there's a significant difference between the amount of mask wearing in London and Tokyo. And in Tokyo, people are even wearing masks outdoors in the summer heat. Next slide. So the Ministry of Health in Japan provides really clear messaging regarding what you should do wearing masks, and they're posted throughout the country in eating and drinking establishments and broadcast through both news and social media. The most recent recommendation since summer 2022 was for masks not to be worn outdoors due to risk of other health problems such as heat stroke. However, many have not followed this and continue to wear them outside without government recommendation or intervention. So while governing health bodies in both the UK and Japan essentially take on both the same recommendation policy towards masks, there is a significant difference of adherence between the two countries culturally. So some of the cultural factors that play with this are that, so while there is this high adherence to mask wearing and things like vaccination without government enforcement, there are also some downsides overall to this strategy. And this sort of normative pressure that drives these habits can be observed through the lens of stigmatization and what is called the self-restraint police, which was coined after the COVID-19 pandemic. And examples of what the self-restraint police have done include public branding and humiliation of people and businesses which are perceived not to be following COVID recommendations, such as those pictures on the right. So for those who are at the receiving end of this treatment, there is definitely a consequence to this of this social isolation, which combined with the collective difficulties during COVID, such as economic troubles, cancellation of community events, which is still very common in late 2022 as of now. There are definitely negative mental health consequences and outcomes. And some experts have argued that various terror incidents where there are multiple public stabbings and in last 2021 are related to the overall greater pressures that have been amplified by the pandemic.
So how do we make sure that people aren't feeling isolated or stigmatized, but rather empowered by our own public health messaging? Thinking about the Belmont principles when decision-making can assist us in this. Respect for persons. How can we maintain respect for persons in a public health emergency? Beneficence. How can we maximize the benefits and minimize the harms of this approach? And justice, what more can be done to fairly protect those who are most vulnerable? It's important to consider these questions both individually and as a group or society. So in summary, Japan has had a unique response to the COVID-19 pandemic from both the government and from the public. Mask wearing was already part of the culture, but this has continued well beyond the first 2 years of the pandemic. High vaccination uptake due to respecting for others around you belief has also occurred. Most of these decisions are made at an individual level with minimal influence from government mandates or policies. For example, this is highlighted by the government insisting that mask wearing is not required outdoors, but the majority continue to wear regardless. And what can societies do for future pandemics? Encourage a culture of solidarity and respect for those around you to be inclusive and not push those on the periphery away. To prioritize vulnerable populations in both public health messaging and allocation of resources, and to act towards a common goal with leaders well informed by public health experts. And these are our references. Thank you for listening to our presentation today.